Hi, I'm Dr. Tim Kaczynski, a general dentist practicing outside of the Detroit area in Bingham Farms, Michigan. Today's topic will be atraumatic extractions, where we can predictably remove teeth where our patients have a positive response to our actions. But many of our patients are very apprehensive about such treatment, and many general dentists just don't like to remove teeth. And why would that be? Well, our patients are afraid because of bad experiences they've had in the past. And dentists don't necessarily like to take difficult teeth out because, just as I said, they're difficult. So we're going to do step-by-step demonstrations, and hopefully you'll be able to refresh your memory by reviewing this DVD frequently when you're doing a procedure, and try to give you techniques that are incredibly predictable. So today we're going to extract our patient's first and second maxillary right and left molars, her first and second maxillary right and left bicuspids, and the right and left maxillary cuspid teeth in preparation for grafting dental implants and an eventual implant retained overdenture. So we're going to use the innovative golden physics forceps, and if you recall, there's 4 instruments in the standard set: the upper right, upper anterior, upper left, and a universal mandibular. So let's start with the upper right extractions, and we're going to use the upper right physics forceps. If you remember, there's 2 components to the physics forceps: the beak, which is the flattened edge, which will engage the palatal aspect of the root structure 1 to 2 millimeters or 1 to 3 millimeters subgingival. We then have a silicone, what we call a bumper, which will be placed as high up the vestibule as possible. The working end of the instrument is the beak, and it will extract the tooth up and out of the socket following the innovative arch of the physics forceps. The bumper only acts as a fulcrum. It's not providing any stress or strain onto the tooth, and it doesn't really aid in the extraction other than adding as a fulcrum. The way the instrument works is we're going to create tension onto the palatal surface of the root in a rotation type of motion, which will create an enzymatic action and a breakdown of the periodontal ligament, allowing the tooth to come up and out of the socket. The tooth is not designed, or the forceps is not designed to remove the tooth in total. Rather, it's intended to dislodge the tooth 1 to 3 millimeters. So let's see if we can engage the bicuspid tooth first. And what I want to do is I want to position the beak as far down the lingual palatal as possible. And sometimes you can just hold it with your finger. I'm not pressing. Now if we back up to my hands, you can see I'm not really holding the instrument tight at all. I'm just really holding it, maintaining it with my thumb, and just putting some slight pressure onto the handle closest to her chin. And what I'm doing is using rotational motion. I'm actually rotating the instrument towards my chest area. And if we go back onto the tooth, and it's constant pressure, it may take a minute or two, and we will see that this tooth will start to lift up and out of the socket. The tooth is moving, it's disengaging, and it will pop. You don't hear a pop, but you can feel the pop. We'll then take the golden tooth delivery instrument, and I will engage the loosened tooth, and I'll rotate and remove this tooth very atraumatically, maintaining that facial plate of bone, which is very, very important since I plan on placing implants in this area immediately. Go to the next bicuspid. And again, engaging the palatal surface, putting the bumper, and this tooth is a little bit loose here, and dislodging it. Now again, the instrument is not intended to remove the tooth in total, but the facial bone, plate of bone is maintained nicely. Go to the cuspid area. Let's just remove that. And again, I'm engaging the palatal surface. I'm going to have you turn your head a little bit towards me. And I'm barely holding the instrument. And I'm rotating towards my left shoulder. This finger is not really doing anything other than stabilizing the beak onto the palatal aspect of the tooth. I'm rotating, not squeezing. You take your time. It may take some time. Remember that cusp, the bone, the facial bone around the cusp is very, very thin. And we would like to maintain that as much as I can. Just take your time. Our muscle memory and our extraction techniques dictate that we want to squeeze. We do not want to squeeze this instrument. And the tooth just popped. Again, it's not intended to remove the tooth in total. We'll take our tooth delivery instrument. And I'm simply just rotating that tooth out of the socket. It's a very long cuspid tooth with a little curvature on it. And we can see we've maintained that facial bone, plate of bone very, very nicely. Going back to the molar area, same technique, engaging the palatal aspect. I'm not squeezing the instrument, I'm rotating towards the patient's corner of her right eye, and really the only motion here is pushing on the lower portion of that handle. And it's rotational motion, no squeezing, and that tooth popped. And we'll take our tooth delivery instrument. And we're able to remove the tooth in total. With a cyst around that tooth, all three roots are removed. And most importantly, that facial plate of bone is maintained beautifully. This is a cyst around that infected tooth. And we have one more on this side, and we'll be done with the right side. And the second molar, again, not squeezing, just some rotational motion. Constant pressure creating tension, which is causing enzymatic action, breaking down the periodontal ligament, and that tooth will pop, as you can see. Okay. And we'll be able to remove this, again, infected tooth quite easily, maintaining that facial bone nicely. So we're finished with the right side, and we'll move on to the left. Now moving to the maxillary left quadrant, we're going to use the physics upper left maxillary forceps. And with the same principle, we're going to engage the palatal surface of the root 1 to 3 millimeters subgingival. I'm not squeezing the instrument, I'm simply rotating my wrist now basically towards the corner of her left eye. And it may take a few minutes, a few seconds, few minutes. Don't squeeze the instrument, and that tooth will pop And again, the instrument is not intended to remove the tooth in total. We'll take the golden tooth delivery instrument and we'll remove that tooth with the cyst intact, but most importantly maintaining that facial plate of bone. Engage the beak onto the palatal aspect. The bumper is as high up the vestibule as possible. I'm not squeezing the instrument, I'm simply using a rotational force following that arc, creating tension on the palatal aspect of the root, causing an enzymatic action, a physiologic enzymatic action to occur. Take your time. When it takes a few moments, we have a tendency to want to rush and squeeze the instrument as if we were using a conventional forceps, and I don't want you to do that. I simply want you to rotate your wrist, and really the motion is, I'm just kind of lifting the instrument with my one finger here. And not even really holding the instrument. And that tooth pops. Go to our tooth delivery instrument. And that tooth just kind of walks right out of the socket, maintaining that facial plate of bone, really long cuspid tooth, and maintaining that thin facial bone nicely. Now, I didn't use a periotome or an elevator or anything like that on these teeth. I went right to the physics forceps, but if you feel more comfortable using a periosity elevator or a periotome to go around the tooth and then elevate a little bit, I'm fine with that. So again, we're just rotating our wrist, not really putting a lot of pressure. And you'll see the tooth start to move a little bit. And it pops. Take my tooth delivery instrument. And remove the tooth. This is not bone, it is infected tissue, cyst. You can see the root structure is broad, cyst tissue there. Again, maintaining that facial plate of bone beautifully. Last one. Tooth is elevated. Now that tooth was pretty far back, and we do have a secondary instrument, which it's called the molar series, which may be a little bit easier. Here we have cyst tissue, facial bone is intact. We're able to remove the teeth beautifully.
For more information and to watch several more clinical videos, please visit physicsforceps.com or call 1-877-987-2284.